Ma'am, you're on mute, I guess.
Hello. Hi, can you hear me all?
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am. Thank you so much for introducing me to this group, Dr. Karthik, and that was a really nice introduction. And I'm really privileged to come and talk to the PharmD students here because this was the same position where I was a few years back, and it's a really great honor to come and talk to the new coming up PharmD graduates. So, as I start, hello everyone. I'm Dr. Neha Tabassum, and I'm a teaching fellow and a clinical scientist at the moment. And most importantly, my roots started as a PharmD graduate. In this session today, I'm going to talk about my own journey from nowhere to a PharmD graduate and a clinical scientist. I hope you all find this session really helpful. In today's session, I'm going to discuss on how I even chose pharmacy, what happened throughout the years, and where I am now. I really want to highlight that I think there is a lot to talk about in between. Like I mentioned, I hope this session is helpful for most of you. I'm just one from the graduate, and there are many, many, many who exist, and there are many other stories as well. People take very different pathways. So I just want to take this chance to highlight what I did throughout the pharmacy school, what I thought was helpful, and what I wish I had more of. And this way, if you're already into your final year pharmacy or you just started your pharmacy, hopefully you can take some tips away from this session and apply it to your own journeys as well. Now, starting to talk, let's talk about how I even picked pharmacy. So, when I was in school, I actually wanted to go into medicine. I thought I wanted to go into medical school, and in general, I didn't know what I wanted to do. But the only thing I knew was that I want to get into the medicine. So, in my senior year of high school, I had an internship at a hospital in the town, and it was a semester all internship, I think. And this was immediately after my 10th standard and also after my 11th and 12th. So, what during this internship, what I was able to do was I was able to shadow the doctors in the ICU, emergency room, the gynae centers, and some other areas in the hospital, and just see what happens in a hospital and how doctors operate, how the whole medical team works together on a patient to make sure that they get better and leave the hospital. Now, this was definitely a great experience. And if you have a chance to do something like this, even if you're not sure what you want to do in your career, I definitely think it was an eye opening to see how the medical team works together, what happens in the ICU versus the emergency room versus the gynae center, and how each of these departments and different areas in the hospital are really different from each other. Now, that exposure as a high schooler was definitely a very high value experience. Now, one day, unfortunately, my grandmother was hospitalized, and look, like when you're emotionally attached to somebody, you have some downtime. And my family was very upset seeing me upset, and they said like they want you to sit in the pharmacy in the within the ICU itself. There was a pharmacy within the ICU. So I didn't realize that that pharmacy was really a career choice at that time. And I just didn't realize their role in the hospital because when I was shadowing, I was just seeing doctors, nurses everywhere, but I never saw a pharmacist anywhere. So I didn't realize their role in the hospital settings. Of course, it seems quite obvious because they provide the medications to the patients, but there is much more that goes into this profession, which is what I realized after so many years. But as a child, as I said, I never thought a pharmacy as a career choice or a career option. So that day when I was sitting with that pharmacist, he was, dispensing the medications and he was talking to me because I was upset. He was trying to cheer me up and I was asking, "Are you happy?" And then he said, like, "Look, I'm really happy with what I do and I don't want to do anything else beside what I'm doing now." And I was really surprised at what he said. And it made me think, what pharmacy profession is, and it made me research into what a pharmacist does and who a pharmacist is and what their role is within the hospital settings and the community and everything about pharmacy. And that was a time I had not yet applied to colleges, and I was still deciding what I wanted to do and where I wanted to go. And I was toying between a few medical options, such as biomedical engineering, radio, and medical school, etc. So now that I researched about the pharmacist and through that understood this profession a bit better than I used to before, when I looked deeper into this and I talked to a few more people around, I realized that there is a 6 years PharmD program in which you will get your doctor of pharmacy. And at that time, this was the talk of the town because I was just from the second batch of the PharmD when it was newly. I think which we were able to hear about this PharmD was this is exactly like MBBS. There is no difference between PharmD and MBBS. The only difference exists that a PharmD can't do a surgery. So that was what I knew about this PharmD program, and I started it. So this program actually caught my eye, and so when I did more research about it, I thought, okay, fine, just a surgery is exempted, but this is exactly what I want to do. I want to help the patients. I want to treat the patients. So okay, fine, I'm going to get into this PharmD. With this, I will fulfill my want, and it just seemed so perfect to me at that time. So then I applied to different colleges, still having that, like feeling in my heart to do medicine. I also applied to pharmacy colleges and some medical colleges as well. And then when I caught admission, in school of pharmacy, I decided to get into this direct 6 years pharmacy program at Deccan School of Pharmacy. Um, Deccan School of Pharmacy. Now, when I talk about pharmacy colleges, there are many different ways that you can do PharmD. One is by doing a direct 6 year program, and the other is 4 years graduate, and then doing a 2 years of post-baccalaureate. I'm sure you all are aware of that. If there's anybody who is just starting to get into PharmD, it's just for them. So now that I've picked my 6 years program, I'm going to just colleges. I'm going to explain what happens every year of pharmacy school out of the 6 years and kind of give you an overview of what it looked like to me when I started doing PharmD. Like I mentioned, the breakdown is generally of 6 years. So the first 2 years are very basic, like your chemistry, your biology, your math. And coming to the third year, now you start getting into very pharmaceutical based courses. And this is the year when you really start diving into the pharmacology of medicine, pathophysiology, and everything else you need to know and learn in the school. And when coming to the fourth year, again, you're diving into the pharmacology of all the information you really need to get to know and understand to be a good pharmacist. At my school, I mean, like, I don't know about you guys, or I don't know about how would the new primary graduates would feel, but for me, it was the toughest year of all the 6 years, among all the 6 years. I think this was the hardest year of all. It can vary, but generally, this is the year that if you make it through, you're smooth sailing. But that year definitely was a rough year for me. I must tell, in this year, I dropped everything and I did not focus on anything apart from the other internships and jobs I was doing, other than the school. And of course, it did pay off at the end. But like I mentioned, you really have to focus, and it takes a lot of your energy, your brain, all you're doing at school, all the time. From the moment you wake up to the moment you go back to sleep, you're only studying, focusing on your job experiences, focusing on learning new skill sets. Make sure you do everything you can when you have the opportunity. There is no right or wrong job experiences. So grab the opportunity, do as much, gain as much as job experiences, as much as some skill programs you can get. Now, in the fifth year, again, there is a combination of your pharmacy school experience, I mean, your lectures, and it's the last year of your lectures as well. And that included your class experience. Now you're again learning even deeper in terms of all the theories and all the information you already have learned in the past few years, and you're getting ready to implement that information in the real world. And now the sixth year of your pharmacy school is usually about all rotations. Now, this is an experiential year to get you ready to go into the real world to work as a pharmacist. Now, really, what sixth year is all about is getting that experience. So, depending on the school, but for our school, I mean, like in Deccan School of Pharmacy, we had like 8 rotation blocks. When I say rotation blocks, these are the different specialty areas in the hospital. That they were 6 weeks long and 2 rotations block off. So, out of 8, we had a choice to make to select any 6 specialty areas, which means we had 6 rotation blocks to complete in various different specialties in the hospital. And this was just as an internship to gain experience. And it is a part of the curriculum as well. And those hours you put in is required by the Board of Pharmacy to graduate and become a registered pharmacist. Now, in terms of experience, as I mentioned, you have to do all these rotations, but this is not the only thing you have to do in the final year. It may vary from school to school, and probably the curriculum has changed now or it has been updated ever since I did my farm day. But you after the for us it was like after the rotations we were free to go home, we were free to do anything we want to do, and that was the time most of the other colleagues of mine as well, they also did some job experiences, they worked in hospitals, they did some project works. So anything at this point, this is a good opportunity for you to do your job experiences, go grab it, do whatever you want to do. Now, in terms of my personal experience, I also had other jobs and internship throughout my pharmacy school experience. So I'm just going to go through those and I kind of highlight that what I did and when I did to give you a brief overview of what my experience of schooling and work schedule looked like to me. So essentially, at that time in India, we hardly had female pharmacists working in the pharmacy. When I say pharmacist, it is the retail pharmacists, retail stores. And even if there were any, people looked at them with a surprise. They were not treating women as equally as their male counterparts. So I couldn't see myself as a pharmacist at the retail store in the future. And the role of clinical pharmacist was not very clear at that time. At least to me, I can say it was not very clear. I was completely disappointed because this was not the image of a family doctor I had in my head. But after reading so much about this newly introduced course, as I said, like when I joined, I had this impression this is exactly as an MBBS, and you're regarded as an MBBS doctor. You can treat patients. There was a very different image of a PharmD I had. So I just wanted to widen the types of experiences I could get within my own college settings and do something even more challenging and differently to what others were doing. Definitely, alongside what I started to do. This doesn't mean that I was upset with the subjects I was reading. This doesn't mean that I was not happy with the curriculum, with the amount, with different subjects I was reading, because that's our strength, that's our foundation. So you can't just leave that. So I never left my studies at any point. I was always curious to learn the basics and everything. So don't quit your studies, but you can still you can definitely learn uh, different job experiences. You can look for different opportunities. So this is what I wanted to do. So during my experience as a high schooler, as I said, when I was shadowing a doctor, and also in my first and second year of PharmD, when I was going to the hospital and in the clinical settings, because we were allowed to go into the hospital and shadow doctors and all, I did observe that the doctors treat the patients, definitely, but they rely on the research a lot. So, what's new in the field? What could go wrong in a patient in certain different clinical conditions, clinical circumstances, and what could be done differently to treat the patients? How the quality of life of a patient improve, and what best they could give to the patients to make their lives better. Now, this thing caught my eyes at that time, that there are people who work day and night to get this best clinical treatment approach to the doctors to help them treat their patients and save their lives. And now that was something I wanted to do at that time. Now, my research story began in my third year of my family's school. And this was my first quest, I guess, in this whole framework, which was a review paper entitled as Progress Against the Treatment of Ovarian Cancer, if I remember it correctly. Yes, that was my first review paper. I must tell that this was made possible only with the support of my principal, Professor Sayed Abdulaziz, and one of my teacher, Dr. Ganda Maitri. They were like rock stone support for me while I was doing this first review paper. Now, this review paper was on ovarian cancer, and it was my first scientific publication. This was the first time I worked towards a research publication. Outside of a set syllabus, I was allowed to pick what I want to research on, and that was really cool for me. So, in this paper, review paper, I discussed the timeline of treatment options which was available until 2013, because this was published in 2013 for treating ovarian cancers. So, the latest intervention at that time was a combination of cytoreductive surgery with HIPEC. HIPEC is hyperthermic intraperitoneal chemotherapy. So the goal of this surgery was to remove all the visible tumors. However, sometimes very small tumors and microscopic cancer cells are left behind. And to prevent these cells from growing larger tumors again in the abdomen, the surgery is followed with this HIPEC therapy. So I then presented this topic in a national symposium and I was awarded the first prize. And from there on, I started to present various latest research work. Of course, not my personal work, but the one which are available out there in different areas of oncology. In different areas, so I presented these new topics in a number of national and international conferences, symposiums, and yes, I did bagged the first prizes in almost all of the one I participated in. And I can't thank enough to all the staff who helped me. Like it was our HOD, Dr. It was our HOD there at that time, Abdulaziz sir, Dr. Ashwaq sir, and we had Dr. Rusman Ahmed sir, Dr. Muqtadi sir. I can't really take the name of all the people who have helped me, and I can't thank them enough for my whole life because they give me this chance during my studies to go participate in the symposiums and conferences. And yes, they did appreciated my work as well. So this is the area oncology where I eventually ended up now as well. I think almost immediately I lashed into this that if I have an idea, I could pursue it. I could actually pursue what I'm interested in rather than just following what someone else is telling me to do. Now, looking at all my work in the field, all the work in the field of oncology in different areas, I was so very much impressed that I wanted that at some point I should present my own work and say it proudly that I have done this new research which could save lives of a patient. Maybe that was something that kicked me off to do research as a career. I decided to think where I can actually start to see how the research is done and how the whole process works. When I inquired in the college, I got to know that Deccan School of Medical Sciences has a great link with Salar Millat Center for Cellular and Molecular Biology, which is also called a CCMB now, and they do quite a lot of research in their department. And they also have a branch in Princess Esra Hospital as well, which is also a branch of Deccan School of Pharmacy. So I approached a professor there. He was Professor Isaac. So he was a medical doctor by profession and also a diabetologist. So who was also a scientist and he was doing a lot of research revolving around diabetes at that time. So I then discussed with him that I want to be a researcher and what is that I have to do to be one in my life. So he explained me in details and he said me like there's a basic skill set which is needed to be a researcher and gave me an opportunity to learn those skills in his lab at Princess Esra Hospital. Now, due to the restricted funding, I wasn't given a chance to do the work independently, but I was allowed to shadow his PhD student, Miss Nusrat Fatima, and I did quite learn the basic molecular biology techniques like PCR, Western blots, primer sequencing, primer designing, microscopy. Now, this is all essentially for a year or more than a year. I have done this with him. Now, beside this, professor gave me a task. One day he just called me in his office and he said, like, what could be done differently in his ongoing project? And if I were given a chance to do a research, how would I do that? So he asked me to start doing some literature review and identify a problem and plan a way to find a way to resolve the issue or the closest we can get in the field to make things better in that area. So I started reading papers and started to collect information from lots of different papers, lots of different journals, and try and identify the problem. But since it was my first time, I couldn't really understand how things work, and I was not an expert because I was not an expert in that field. I went back to the professor very disappointed and I said, "Look, professor, I understand what I'm reading, but I can't really make out how to, come up with a new question." And he said, like, "This is normal. This is what happens with everybody." And he was so generous enough that he made me to sit with him, and then he discussed a few projects which he already had in his mind. And then finally, looking at my interest and looking at the way I was working with him, he gave me a chance to do a part of his ongoing project independently, all by myself. That was cool. So this was a project called Role of Myeloperoxidase Variants and the Risk of Coronary Artery Disease in Type 2 Diabetes mellitus patient. And this project was approved by Indian Council of Medical Research. And at this point, here I learned how hypothesis of a research, plan your research, and how to take it forward along the way. And not just that, most importantly, this was the stage where I learned that failures shouldn't stop you from doing your job. I learned that no result is also a result. I'm saying this because we didn't publish this work straight away after I did the experiments with them and after I did the project with them, because we didn't have significant number of samples and we didn't have significant data to show or to validate our hypothesis. So we had to wait for a while, and that was the time when professor was telling me that, "Look, Neha, no result is also a result because nobody has ever looked into it, but you did, and you can say to the world that I have done this research and I found that there's nothing which happens in it." So that in itself is a new research. So that was something I learned at that point. And I was trusted to work on my own completely independently. I was trusted to plan my own time, plan I was going to write the whole thing up for the paper, plan even how I'm going to structure literally from the beginning to the end. It was just like my newborn baby, and I really loved that process. And I also enjoyed the process of supervision where you were doing the work yourself, but you had somebody who was experienced in the field of education who could help you write, but not tell you what to do because this is all by yourself. Just give you a helping hand along the way. And I think I much prefer that relationship in education to just being taught. So again, maybe that's something that kick-started me down doing academia as a profession. Now, which is just as well, it only got more and more intense as the years went on. That year, first year taught me how to be a student outside of a curriculum and outside of the school and follow what you are interested in. The elements of this came very useful throughout my career up until now. Now, that kind of pushed me further down the line of academia again. And the crucial stage came in my final year research project, because in the fifth year, you've got a final year project to do, which is a 6 month. This is also a part of our curriculum while we do our farm day. So it was a 6 month research project where it was a real thrill because to be able to design a whole experiment, say this is a problem, here's the hypothesis, let's work it out, observe your results, conclude your results, and then evaluate it how well your results are, and actually translate that into a real world experience. That was an amazing feeling which I had while doing this project. So doing this project was an eye opening for me again because it did help me a lot. Firstly, it confirmed that I wanted to do a PhD. Secondly, it was my first foray into learning. So my work was published entitled as Varied Virological Response of Patients with Chronic Hepatitis C Against the Treatment of Pegylated Interferon Alpha and Ribavirin. So I think I got the highest score in my project. That was even better, and it was encouraging me to do more and more research in my career. So oncology is the area that I eventually ended up with now. So since the beginning, I was always been interested in doing cancer research. Now, whilst I was still doing my rotations, I started to literature review and see if there's anything I can do as my own personal PhD project. And yes, I got a clue. I came up with a hypothesis and I decided to do a project in trying to find an association between the age of first full term pregnancy and subsequent risk of developing breast cancer. So I emailed two universities at that time. One was New York University and the other was Imperial College London. And yes, it didn't take long, and I had my decision on my admission application from both the universities within 20 days of the submission of my application. And now was the big thing, the money. I come from a middle class family, and my father is a retired army officer, and my mother a homemaker. So my parents couldn't afford that big, huge tuition fee and the money for the research in abroad. So I then began to apply for scholarships within Imperial College London and also outside Imperial College London. A big, long process. But long story short, I got funding for my research project, which was £144,000. It was more than a crore rupees, and then it covered all my work for my research work. But since I was an international student and the law in UK doesn't allow you to pay the full fees of a international student, they asked me to pay half of my tuition fees. So my parents have always been very supportive to me, and though it wasn't very easy for us, they did manage to pay that money, and I started my PhD. So during my PhD, parallel to my main PhD project, I also participated in different projects and the clinical trials in doing prostate cancer research and also in breast cancer research. I did sequencing for other clinical projects, and I did lots of assays in different clinical trials. I started, and beside all these things, I also started medical students and graduate and undergraduate students at Imperial College London. And this is why I say that never skip your studies. Don't think that you're not seeing any future, but concentrate on your subjects. Grab the opportunity to learn the basics, because if your foundations are strong, you can do anything in the world. My basic foundations, the basic subjects, and of the understanding of the basic subjects, what I've learned during my family, this has come into play when I started teaching the medical students and the graduate and undergraduate students at Imperial College London. So my efforts were appreciated, and I was awarded associate fellowship from Higher Education Academy in UK. And then I also wrote papers for some very high impact factor journals like Nature, OncoTarget, Oncogene, and Science. Also reviewed scientific research papers in esteemed journals from Nature, Oncogene. I'm currently a reviewer for Oncogene Journal now. I was then invited to present my PhD work as a speaker in the Royal Society of Medicine, where I was awarded two, and I presented chunks of my research at San Antonio's Breast Cancer Conference in the USA and in British Association of Cancer Research at Newcastle in UK. And Alhamdulillah, I was awarded the firm. After my PhD was awarded, I applied for jobs within Imperial College London, and now I'm teaching. I'm a teaching fellow also, beside being a clinical scientist in the cancer genetic groups in Department of Surgery and Cancer at Imperial College London. As of now, that's kind of my course of action. That was generally my experience. I hope that gave you some kind of insights on how my process was into how I put my time during these years to be where I am now. I have a lot more to do, inshallah. This is just the beginning of my career. I'm not a big personality. I'm just starting my career, and I hope this session was helpful to you. And I'm very happy to answer your questions, any follow up questions if you have any. Thank you again.
Excellent, Dr. Neha.
Excellent, Dr.
So,
Neha. So,
Thank you, Dr. Karthik.
proud of all the achievements.
it was so
It
real,
was
so
so real, so
inspiring.
inspiring.
I hope
I
it
hope
really
it
helps
really helps
students.
students.
So now it
So
is
now it is
open for
open for
questions.
questions.
You can
You
ask,
can
or
ask
you
or
can
you can
share your
share your
feedback.
feedback.
Hello, Dr.
Hello,
Neha.
Dr. Neha.
Hi,
I hope I'm audible.
hi, Akila. Hi.
Yeah. Hi. Your session was very inspiring. It was inspiring to me because I'm just following your path, and I'm excited. I'm really excited. I'm seeing a person who's already successful doing it. So I'm interested in pharmacogenomics, and I'm in the process of applying for a PhD, and I've applied like for two universities in UK.
Mhm.
And what was surprising for me to hear from you was your hypothesis was being approved, and you were being funded with no change in your hypothesis for the PhD.
Yes.
That was very fascinating for me to know that it was approved. Can you tell us a bit more about it?
So basically, when you are trying to find a hypothesis for yourself, make sure you do quite a lot of research. Be very research intensive because while you do your sixth year, your final year, it's all about just rotations as an internship. You follow doctors, you learn new things, and you do. But the rest of the day, you're all free to do anything. So make sure you do lots of papers, you read lots of papers in the area you're interested in, and try and find a gap in the research in that area. And if you can grab that opportunity, if you can be sharp enough to identify that gap of knowledge within the area you're interested in, that would be great. And then that is your research question. And then the next step would be how would you resolve that answer? Because whatever question you have in your head, how do you think you're going to plan to answer that question? So that's your methodology for your research. Make sure you identify that. And while doing this process, probably because when I started to identify, when I read loads of papers like epidemiological studies, it said like when you are at the age when you are either 24 years of old or less than 24 of years of old and you have your first pregnancy, you have 50% lower risk of developing breast cancer in the future. And if you have the same first term pregnancy after the age of 35 or exactly at the age of 35, you had 35 to 56% higher risk of developing breast cancer. So that was my research question because I got that gap in the area of breast cancer research that nobody has looked into it. Why? Because pregnancy is the same physiologies. Pregnancy does exactly the same in an older woman and a younger woman. But what is that which puts the women at a risk of having breast cancer at an older age? So that was my research question. So while I was doing this, I wanted to analyze like how I'm going to answer my question. What do I need at this stage? So I wanted normal women because I wanted the breast tissue samples for normal women. So that was my first criteria. So try and identify how you are going to answer your own research. What am I going to do with my sample then if I get my samples? So do I want to do sequencing? Do I know how to do sequencing? Then start learning that sequencing. And once you have your sequencing data, do you know bioinformatics? Do you know how to analyze your sequencing data? Grab the opportunity whenever you have to learn bioinformatics, to analyze by yourself, because you understand your question much better than anybody else on earth. So these are small things, but it plays a major role in your life. So don't waste a minute of time in your life. Just grab the opportunity and try and do as much as you can. One thing I can suggest, what I did personally was different course from Coursera, from John Hopkins University. And that are the some courses which I've done before starting. I've learned some basics of genetics, some basics of bioinformatics. I did learn from that. And this is a certified course. While you end up the course, you get certificate as well. So you can, there must be many things. I'm sure Dr. Karthik knows a lot of platforms which could help students. And I'm sure he's guiding students in the better way. So there are many things out there. Try and ask your mentors, be loyal to your mentors, listen to your mentors, and follow what your mentors say, and be respectful to your mentors. They would guide you to the best pathways. I can't thank my teachers enough for what they've taught me. So just do that. Hope that answers your questions, Akila.
Thank you so much,
Thank you
Neha.
so much,
That is really
Neha.
helpful.
That is really helpful. I know
It makes sense. Because
Thank you. Thank
more
you.
often than
More
not,
often than not,
if you're very clear about your hypothesis and if you have everything preemptively ready for it, it happens that the professor and whose lab position is available for funding, or let's say a graduate position is available in his lab, he would probably want one of his research which is already being funded. He wants us to work, usually hear from researchers if you want to work in their lab.
Dr. Neha, you are on mute. So actually, when someone is asking a question, you can keep yourself mute to avoid echo. And once they're answering, you can unmute.
Sorry. Can you hear me now, Akila?
Yeah,
Thank you.
Neha.
Uh, well, there are two different situations that could occur. One is when you apply to a research group which are running and they have available funding. Getting funding for the research is the biggest task. Even you know the oldest professor in the field, the most experienced professor in the field, struggle a lot to get the funding for the research. So you are lucky if you are applying for a project which has already been advertised and has got funding. But in case you don't have that, then we are unlucky. And if you have your own idea and you want to do your PhD on exactly what you have as your hypothesis, then you will have to look for your own funding. And I personally don't know many colleges which have funding for their research, because I see there is a lot of struggle in the path of getting funding for the research. So if you find something like that, please grab it as soon as you can. And then if maybe once you start your project, you can just have a word with your professor and say, I have also got an idea about a new thing in my head. And then eventually, I mean, like you're not entitled to do only one project during your PhD. You're free to do as many things as you can, but within that definite time frame. So make sure you talk to your professor about your own hypothesis as well.
That helps me a ton. Thank you so much. I don't know if I was audible. I really thank you for giving me this advice.
Oh, thank you, Akila. Thank you for the question. I hope it was useful. Thank you.
Thank you so much.
So, Dr.
So, Dr.
Neha,
Neha,
I don't.
when you
when
said
you
that
said
you
that
travel to
you travel to
UK,
UK,
what all
what
arrangements,
arrangements,
etc., did you
etc., did you
make,
make,
especially to
especially
cope
to
up with
cope up with
high climate
climate
and
and
the other
the other
aspects? How did
aspects?
you
How
plan
did you
for
plan
that?
for that?
To start with, I come from an Orthodox family where you're not very open and you don't really get into new environment quite easily. My mother was very scared when she was sending me to UK for doing a PhD. And then she said, I want you to go either to UK or USA and nowhere else, because in the USA you have your brother, in the UK you have your uncle. So it was very clear for us that once I arrive in UK, I'm going to stay with my uncle. So I didn't have to struggle a lot. Very thankful to him because he did supported me quite a lot with the accommodation and everything. There was an emotional support he had given me after coming, leaving my parents. He was just like a parent to me. So I didn't have to struggle a lot as any other students. But when anyone from you are planning to get in, please make sure that you have an accommodation before you come into UK, because it's really expensive out here and you have to plan your expenses before you'll end up in London.
Yeah, and how do
And
you
how do you
manage
manage time
that you are
that you
doing
are doing
multiple
multiple
research is
research
not
is
easy.
not easy.
So how do you
How do you
manage your
manage
time
your
and
time and
handle all the
handle all
things
the
which you
things
have?
which you
It's definitely not very easy, Dr. Karthik, I must tell, because I remember, because I have a habit of waking up quite early in the morning. So as soon as I wake up and out for prayers and everything, I used to start for the college around 6. And then since I was doing micro laser capture micro dissection, because I was dissecting normal cells from a normal healthy breast tissue, which was very difficult because there are not too many cells you see. It's only in cancer tissue you see lots of epithelial cells, but not in the normal one. So I had to select each cell and then ask the laser to cut it. So that was a very tedious task. So I had to start quite early, and I was in the college around 6 to 6:30, and I used to come back from college at only around 10:30. And during that whole day, trust me, I not even had a time to have my lunch or anything. First 6 months were all about learning techniques. So I did learn different techniques like bioinformatics and all stuff. But after the 6th year, when I had my samples in my hand, I had no time to talk to anybody, no social life. But just because I was living with my family and his family was quite really good to me, I didn't feel like I'm away from the family. It's only over the weekends I had some time to interact with the family. And even at that time, I still had to read quite a lot because I was also teaching simultaneously to medical students, and I had to make my lessons ready for that. So it was quite difficult, but if you are passionate enough, it seems quite easy for you to do your work. So I think like it was only my passion and the prayers of my parents which helped me to get through this situation, and I did my PhD quite well, and I'm happy with what I did.
Yeah, here I
Yeah,
would
here I
like to
would like
share
to
how
share
our
how
research
that,
method.
that
So we
so
had
we
one
had
of our
one of our
students,
students,
which he
she
connected me
connected
to
me to
you.
you.
So
So
your name is
your name
Asad.
is Asa.
And I
And I
made a
made
call
a
and
call
talked
and
to her
talked to
for
her for
maybe an
maybe
hour
an
or
hour
so.
or so.
And she was
She was
telling me
telling
like I
me
will
like I
come
will
to
come to
India and
India
stay
and
here
stay
for
here
maybe
for
a
maybe
month.
a month.
And I want
And
to
I
use
want to
that
use
one
that
month
1 month
productively
productively
and see
and
if I
see
can
if I
help
can
my
help my
students in
students
India.
in India.
So that is
So
how
that
our
is how our
conversation
conversation
started.
started.
I was
I
really
was really
impressed with
impressed
someone
with
who has
someone who has
hectic
hectic
schedule.
schedule.
Maybe they can
Maybe they
come for
can come for
India for
India
a
for a
vacation,
vacation,
spend with
spend with
family,
family,
and take rest,
rest,
relax, and
relax,
go.
and go.
But she was
She was
so
so
interested to
interested
use
to
that
use
one
that
month
1 month
productively and help
productively and
all the
help all the
students.
students.
Basically, she does not, especially how students from first batches struggled. And also, Dr. Neha, I enjoy a very good relation with your college, especially principal sir and also vice principal sir. So I constantly talk to them. I visited your college few times. So I'll share this video link with them and they'll be really proud of you. So I think there are some questions in chat box. Let me. So, ma'am, have you applied for pharmacist licensing in UK or you just want to continue in academics? You are muted, doctor.
Sorry again. I haven't registered for now because, as I said, it was a very busy schedule and I had no time for myself while I was doing my PhD. And it was only a few months, 5 months back, I've been awarded my PhD. So I am now applying for my pharmaceutical license, and once I'm uh, done with it, I might do some sort of pharmaceutical based research as well, and combine it with oncology and see how it works and how there's improvement in the treatment approach for patients, because there's a lot of gap here. There is a lot of opportunities for pharmacists to work in the UK, and I'm sure Dr. Karthik will get back to you because we have agreed upon a session on careers in the UK as well. So we might discuss about all the career options we have in the future. So I might do something in that, inshallah.
So how
So
to
how
I
to I
find a
find a
reasons
reasons
question?
question?
Good evening, ma'am.
Good evening, ma'am.
Hi, good evening, Supriya. Good evening.
I want to ask, like, you did
I want to
PhD
ask,
from
like, you
Imperial
did
College.
PhD from
So, like,
Imperial
we,
College.
if a
So, like,
person is doing
if a
PhD
person,
and then they can apply for pharmacist license in UK, is it like I heard that we need to do overseas course for pharmacist if we want to apply in pharmacist license? Ma'am, you are mute.
Sorry. You have to work, you have to study for 2 years here. Doesn't matter what you do in India, you still have to come and study here for 2 years and do 52 hours of free, of course, voluntary work in the hospital as a pharmacist. You won't be paid for that. Mind you, then you'll if you are coming in, so make sure you arrange your expenses also, because you won't be paid for that 1 year plus for the 52 hours you're working in the hospital. So once you are done with that 52 hours of free voluntary service for the hospital NHS, then you will be asked to sit for an exam, and then if you clear that exam, it's only then you will be offered. You will be a registered pharmacist here.
Okay, ma'am.
okay, ma'am.
So
So,
yeah, actually,
yeah, actually,
we can
we
ask
can ask
questions later.
questions later.
Maybe one more
Maybe one
questions
more
will do.
questions
I'm
will do. I'm
excited
excited
actually to see
actually to
what
see what
students felt
students felt
listening to
listening
these
to
questions with
questions
knowledge
with
take
knowledge
later.
take later.
So
So,
any
any
feedbacks now?
feedbacks now?
I want
I
at least
want at
towards
least
the
towards the
students to
students
just
to
open
just
up and
open up
share
and share
what they
what
feel.
they feel.
Hello.
Hello.
Well,
Well,
Hi, Mushtaq. Hi, I can hear you now.
hello. Good evening,
hello.
ma'am.
Good
I'm
evening, ma'am.
Mushtaq,
I'm
a
Mushtaq, a
family intern
family intern.
from Sultan College. Ma'am, your session was very inspiring, ma'am. The journey you shared, like from like developing skills and to going to like real research, it was very inspiring, ma'am. Like basically, I learned from your session like we have to develop skills and you have to go like out of the box, do things better, and we can get success in the life. So thank you so much, ma'am, for your session. I am
I am
also
also
having interest in research, ma'am. I also did a few review and research articles, ma'am, recently. So it was very helpful for me. Thank you.
Thank you so much, Mushtaq. Thank you.
Good evening, ma'am.
hello, ma'am. Good evening, ma'am. Hello, ma'am. Good evening, ma'am.
Hi there. Good morning. Hi there. I can hear you now.
So, ma'am, we are streaming
So, ma'am,
live
we are
in YouTube
streaming
and
live
we
in
have a
YouTube and we
question
have a
in chat box.
chat box.
I can't hear you there.
So, we are
So, we are
streaming live in
streaming live
YouTube,
in
ma'am,
YouTube
Mhm,
and we have a
and we have
question
a
in
question
YouTube
in
chat
YouTube
box.
chat box.
mhm.
So, Rakshan is asking what is the process for applying PhD in UK? Ma'am, you are mute.
Sorry. So basically, every college has different admission criteria. So you have different eligibility criteria in different universities. So I don't know which university you are planning to apply, or any other are planning to apply. Make sure you check the eligibility and make a checklist for yourself. And if you can basically get some basic skills, as I said, when I went to Professor Sark. And I said that I want to be a researcher. He did advise me that there are some basic skills you need to do research, like PCRs, Western blotting, sequencing, primer designing. So these are very basic skills which you can learn. I think in a span of 6 months, 6 to 7 months, but you should do it repetitively. You shouldn't miss your class. So I would advise you to do that. And after that, you'll have to come up with a hypothesis. And as one of the attendee just said that if she's applying for a PhD, and if there is a project available for you out there from a professor who has a funding for the project, make sure you read his papers beforehand, two or three previous publications related to the project you are interested in, and then see what are the skills needed for that. Make sure you learn those skills, because once you start your PhD, you won't have time to learn things and then do your PhD at the same time. And in the UK, you have definite time to do a PhD. You can't do a PhD of like beyond 4 years. You either have to do it within 3 years or 4 years, maximum 4 years. And if you can't do that, then you will not be awarded a PhD. So make sure you have some skill sets in hand before you apply for a PhD. And then the procedure is different for every college. I can't say a definite structure, but it's all about following the instructions from each individual colleges. I hope that answers your questions, Uday.
Yes, ma'am. Thank you. And what are your plans after PhD?
As I said, I am still working as a researcher. So I am continuing my research. The data from my PhD was phenomenal because nobody ever looked into normal breast. And this is for the first time in the research of breast cancer that I've looked into a normal breast. So now I'm continuing to develop a model for every clinician, that if a patient comes in the clinic and says, I'm 27 years of age and I want to have my first baby, what is the risk of me getting breast cancer and what are the different mutations I will have? So, if there is any risk, any women in the risk category, you can put them into surveillance and have a record track on them and then prevent them from having breast cancer. So that's the plan. So I'm still working on that. Simultaneously, I'm also teaching in the college as well. So that's two things I'm doing at the minute. I hope that answers your questions there.
Thank you, ma'am.
Good evening, ma'am. Myself, Satyashree.
Hello, Satyashree. Hi.
First of all, thank you so much, ma'am.
It was a pleasure.
After listening to your journey, initially the uncertainties which you have faced regarding our profession, I too felt the same. But after listening to to your success, it just gave me a kind of reassurance that if we continuously put our efforts with 100% commitment and dedication, we can definitely reach heights. And your journey as a researcher is truly inspiring for all of us. Thank you so much for addressing all of us, ma'am.
It was a pleasure talking to you, Satya.
Yeah, so Dr. Neha, thank you so much. And we will end the session. So this session is streamed. I'll share the link with you. You can share with all your family contacts or whoever.
I will definitely do that. Thank you so much, Dr. Karthik.
So yeah, Alvin, let's end the session.
Thank you, everyone. Bye. Bye. Bye for now. Bye.
Thank you, ma'am.